Good morning, good afternoon, good evening, colleagues. It gives me great pleasure to welcome you to this webinar as we commemorate World Humanitarian Day, which is usually on the 19th of August of every year. We remember those that we have lost. We remember the havoc that we see when it comes to malaria control. As the RBM Partnership to End Malaria, it is obviously important that we reach our global malaria targets. With the humanitarian crisis that's before us, it is even harder to get to the targets that we want to get to. In 2023 alone, we saw that 117 million people globally were forcefully displaced. Unfortunately, 2/3 of these people are in malaria endemic countries. We also know that refugees and internal displaced people are even more exposed to malaria when these events occur. They're more exposed because of lack of access to health, more exposed because of water and sanitation challenges, more exposed because of mobility issues, because of nutrition issues. As we commemorate World Humanitarian Day, we should not forget some of the conflicts that we see, but also effects of climate change. We've seen that climate change has caused havoc in many of the countries, including malaria endemic countries. If we look at 2022 alone, we saw a 5-fold increase in malaria cases in Pakistan. We've seen communities hit over and over again by floods, by cyclones, which obviously makes it difficult for malaria control. In the cases of humanitarian situations, we see that host communities, partners, donors really look into supporting the life-saving efforts, which include water sanitation, shelter, food. And there's hardly enough resources left for us to focus on malaria. Malaria, a disease that is preventable, that is curable, and that is still affecting millions and millions of lives. In 2022 alone, we saw 247 million cases of malaria, over 609,000 deaths, mainly affecting children, mainly affecting pregnant women as well. So as we commemorate, we also need to ensure that we focus and put the spotlight on the people that are serving the vulnerable people the most. The volunteers, the community members, the governments that are supporting community health workforce. It is really important that we spotlight them today as we commemorate World Humanitarian Day. From the RBM Partnership's perspective, we obviously want to do more. We obviously want to ensure that humanitarians and people that are affected by conflict are really given the spotlight, are really supported as much as possible. From the RBM Partnership perspective, we do this in a few ways. The first one is obviously we support in terms of resource mobilization. We support in terms of supporting countries in national strategic plan development, which we do year in, year out with the various countries. We support with Global Fund grant applications, which is really important for us in terms of ensuring that countries have the needed resources to be able to ensure malaria control and prevention. We also support in terms of the toolkit or the toolbox when we look into vector control. This is important for us, obviously, in terms of making sure that we broaden that to include the displaced populations. We do a lot of resource mobilization, a lot of advocacy at regional, country, and global level. On this day again, I would love to commemorate and really put a spotlight on United Nations Foundation and the AMP, Alliance for Malaria Prevention, on this fantastic initiative of putting spotlight on humanitarian issues, on conflict, on climate crisis. I think this intersection is really, really important for us. And as the RBM Partnership to End Malaria, we will continue to ensure that intersectionality, really making sure that we link malaria more with humanitarian crisis, we link malaria more with the climate crisis, we link malaria more with a gender lens. It is important for us that we have strategic partnership, operational excellence, and we work together for the benefit of the most vulnerable people. As RBM Partnership CEO, I stand firm and I stand committed to work with you and to ensure that we leave this world in a better place. Malaria prevention is very much at our forefront. We know the commodities that work. We know what we can do to make the lives of our communities better. Today, as we end this speech, I would like to reaffirm my commitment towards your cause, towards our collective cause. Zero malaria starts with me. Zero malaria starts with you. Zero malaria starts with everybody. Malaria elimination is possible in our lifetime. I wish you a successful webinar and thank you.